am Joan, I'm 48 years old, I have PHTS, I live in Brabant and this is my story. When I was 2 years old, I had a really big lipoma and they were scared to do the surgery. So that's why we came to the Netherlands. And yeah, then I had a big surgery to remove the big lipoma. During my childhood, I had several lipomas. They are all removed. And then when I was 14, there was a big problem in the back of my neck and there were dilated blood vessels. She was not allowed to do the surgery. So I had to go to a different hospital. So we put pure alcohol in it. And then he said, problem solved. Yeah, so you are better. But the problem was, it was in the back of my neck. And when the sun was shining in the back of my neck, I had pressure pain. The blood vessel problem was not solved. It was growing. So I did go to another hospital in the middle of the Netherlands. Yeah, and the first time we came there, we just sit and talked. And the story with the lipomas, with the blood vessels, and some other signs you see on my skin, and they noticed I have a big head, and that's also a sign for PHTS. So he said, I think there is a different problem. Maybe there's something wrong in DNA. So we did some testing, but there was not, yeah, it's so long ago, there was no DNA testing then, but they thought, yeah, there is something wrong, but we cannot prove it. But since I was 17, I had really big breast infections. And then in 2012, when I had a really big breast infection, after maybe 6 or 8 weeks of antibiotics, I was in hospital in Veldhoven on a Sunday, and there was a doctor who worked in Nijmegen. And he said, I think you have another problem, not only a breast infection, but he thought maybe it's also dilated blood vessels on that moment. But he said, I want to ask your file in Nijmegen, and I want you to go here. And the day after, Radboud did call me and she said, we want to talk to you because we think you have Cowden, PHTS. Yeah, I went to Nijmegen the day after thinking about, okay, then maybe in the future when I have a problem, then problem is solved in a short time, something like that. Yeah, and in 5 minutes she said, yeah, I'm sure you have Cowden disease, but I only need to prove it. Yeah, and that took 6 months and then it was proven. Yeah. The risk of breast cancer is higher, but I had so many breast infections and yeah, it always came back. So then the advice was to do the mastectomy. When they did see the tissue, It was a little bit green on the inside, so it was infected. So if I didn't do the mastectomy, then I had the rest of my life all the breast infections. And it's so nice in my head that the chance for breast cancer is 1%, and 1% it's rest in my head. Once a year for my uterus, I go to see the gynecologist. Once a year, thyroid surveillance. The colonoscopy, when it's good, then it's every 5 years. If it's not good, then the doctor tells you you need to do it 2 years. No problem. Wat deed ik nou nog meer? The meningioma in my head, it's now every 2 years that it goes in the scanner. After the diagnosis, then it's a lot to see every doctor once a year, once in the 2 years, whatever. But you get used to it. You will get used to it and see it on the bright side. If it's good, then you are happy. And if it's not good, they will take care of you and will give you a proper advice.